Okay, so last year we did a session for Digital Leaders Week and we framed it as a bit of a workshop conversation around how we build development communities and collaborate on things. And it went down quite well with a few people who turned up, but one of the bits of feedback we got was we should have more examples in the mix to help start conversations. So this year we are focusing on data modeling and children's services. It's a topic that keeps coming up in all the different kind of meetings and groups that I participate in. And it's something that we're running a project on at the moment. And what we have done is pull together a few kind of exemplar projects from people who've kindly agreed to speak this afternoon. We'll do a few presentations and hopefully leave a bit of time at the end for either questions directly to individual presenters or discussion or people to just raise problems or thoughts or comments or whatever else they might want to speak about on this subject. And then obviously we'll hopefully advertise at the end our spaces for local authority colleagues to continue those conversations into the future. So agenda for today, I'm just going to introduce things as I am doing now and talk for a few minutes about data to insights journey with data modeling so far, and then pass over to some presentations from colleagues in Dudley, that's Injit Lahell, East Sussex, Alistair Lee, and Surrey, whose council name I've missed off the list there, sorry, Sari DeSerto. They'll each give a kind of 5-10 minute presentation on something interesting that's been going on in their local authority that might be useful to think about for other councils. And then hopefully a bit of time at the end for a bit of discussion. So without further ado, I'll pass off into the data to insight bit. It's about modelling placement demand. And the story starts really with a completely different problem. And one of the first things that data to insight did once it got some kind of full-time resource established last year was start a project to model likely demand for front door services in social care at the end of 2020's lockdown period. And we did a project with local authorities and produced a tool which lots of people found very useful. Some authorities found it gave them quite accurate or timely predictions about what might happen in their front doors when lockdowns ended. And we then tweaked that and refined it a little bit for earlier this year, the first lockdown of 2021. And again, it was quite useful. But the longer this period of time goes on, the less long-term usefulness this kind of tool has, partly to do with the way we were looking at historical data and defining what counted as normal and what counted as a deviation from normal and what have you, and partly just for other reasons. But it clearly demonstrated there was a lot of appetite for this kind of work, hence the workshop today to talk about it more. So we're currently starting a follow-on project, which is a lot more focused. And the way we got there was we took the original piece of work and went back to get feedback and then went out to do some discovery work with local authorities to ask about what kinds of modelling or predictions or forecasting or just understanding their data did they want to be able to do but they couldn't really do well locally, or did they think was really important, or most important of all, did they think would lead to an actionable decision, so they would do something differently having seen the model data. And we brought lots of ideas out of that, but the key point was that we wanted to do something specific and kind of self-contained that would demonstrate how useful this can be in relation to a decision you can make differently having seen the data, something you'll do based on that information. And modelling placement demand came out of that user research as a consistent need across every LA we talked to. So our key brief at the moment, and we're in the first bit of design and build at the moment, having completed that user research, is about forecasting demand for placement categories so that LAs can ensure there's supply to meet demand and they're getting best value. And what we want to do with that is use historical data sets and timely kind of up to the minute data to supplement those and build out a placement demand forecast from that, based around understanding what the useful segmentations of that data are. So we're not just saying you need 500 placements in your local authority, or you're going to need 520. We're saying which kinds of placements or which kinds of children or which kinds of situations lead to which kinds of demand. And that's the place we're at the moment. So the approach is to build the very simplest thing we possibly can that will model some demand and will work based on that historic data. And we can test it using historic data as well to see how well it performs in that area. Easy for local authorities to put data into, because data to insights purpose is to build tools that people can use easily, saves them time rather than creates work for them, and helps them see which segments are the drivers of future demand. And then take that and iterate it over the remainder of the project to see where we can take it. I'm kind of flying through these slides, but I can make them available afterwards if people want to read all the detail. So this is our roadmap. And the important thing to understand about this is we've got a very small amount of stuff on the left of the screen saying the minimum viable product we want to produce, takes data from the SSDA 903, models placement demand from new starts and from placement transitions, and allows a user to then model future demand from that. The middle bit says, when we release this to our users as a first public release, then we'll be doing that plus something else from the right-hand side of the screen. And the right-hand side of the screen is all of the ideas of things we think we'd be able to then expand into once we can do that first thing. And so all of those things are things we'd like to do. We'll figure out which thing is the best fit for our users to add in with the time we've got to build a tool that, as I say, is self-contained and really just useful in making a decision locally. The last thing I wanted to speak about on this is how we're delivering it. And the data to insight model really is about collaborative development and about pooling resources across local authorities. So where there are things that we all need to do, or lots of us need to do in similar ways, and we can brook a little bit of compromise about the details of how it's done, then we can tap into economies of scale. We can tap into funding streams that we wouldn't be able to get into as individual local authorities, and we can develop things that we wouldn't have been developing otherwise. And the kind of development model we're trying to prove here is the same one we used in the first phase of the project, where we have a very small core resource. We're working with a partner called Social Finance, a non-profit technical team, small resource from me at Data to Insight. And then there's a small circle of local authorities around that who are involved from start to finish. And then a slightly bigger circle of local authorities who dip in at different points to give us fresh eyes perspective on the project as we go and make sure we're not going down an unuseful rabbit hole. But then there's the whole wider community around the outside who are welcome at all stages to keep tabs on what we're doing, feed in their ideas and their thoughts, and of course use the product for free once it's finished, and keep sending that feedback and keep helping to iterate it into the future. The key thing to say is about building in this way is more difficult than just building a tool, but the potential benefits are bigger as well, because we don't just benefit from skills that exist. We bring those skills into our community and we're able to use them and reapply them to different projects and different purposes once we've got them. So one of the key partners on that, is we've got Birmingham Council, Sutton Council and Dudley are our regular feedback circle for this first bit of this project. And that brings me nicely onto Dudley Council, and we've got Indigit Lahell here to do the first of our overviews of a case study of something that's happening in a council at the moment that might be interesting for people. So Indy, if you're there, I will hand over to you.
Yeah, shall I, how are we doing slides? Shall I just upload?
Yeah, if I let you share your screen, then that'll be easier for you to drive than for me to drive.
Cool. Can you see that?
Yep.
Yeah, cool.
Got it, thanks.
Cool. Okay. Hi everyone, my name's Indy Lahell. I'm the Head of Integrated Commissioning, Performance and Partnerships for Dudley Council. So keen interest in this around, I guess, one being Head of Commissioning for Adults and Children's Social Care, including SCND, but also the lead for performance and intelligence as well within the council. So it kind of hits a fair few of my areas really. So what we tried to do in Dudley was look at what we've got in the system. So a bit of background really for us. So we've got number of looked after children in Dudley's been, I'm going to say, fairly consistent. It's been between 620 to upwards of the high sixes. Spend within residential placement is growing as I guess it is in a lot of authorities. We've got some good work going on around supported accommodation. So we're looking at developing a new model around a partnership model with the voluntary sector. So that's quite exciting. We've got a number of internal residential homes in Dudley. And then you've got the whole kind of the fostering piece where we've got internal fostering, we've got external fostering as well. And, you know, what are the, I guess, you know, as a commissioner, it's like, what is the true cost of that and what's the best way forward in terms of our fostering offer? So that's just a little bit of background to where we are in Dudley. So what we did, so one of my analysts and one of my commissioners undertook an exercise. So we looked at where we are in Dudley in terms of numbers, our spend across each of the areas and our growth over the last 5 years. Our aim was to develop a tool so we could start to look at things a little bit differently. So around looking at placement types across our population. The aim was to look to change, if we could project and change different factors within our tool, to change the journey of children using a different approach. So my thought process around this was, if social care adopted a fundamental change model operationally, what would that mean on the journey of a child and our intervention models that we need to put in. Ultimately, we'd look to influence our spend across our population. And then the key bit from a commissioning perspective was to start to have very different conversations with our market. I think, at the moment, and as it is kind of nationally, the market is provider led. And what we want to do is start to use our models and our tools to start to change conversations, have some more strategic conversations with some of our different providers. So we started that a little bit with a couple of providers. It's kind of stalled a little bit, but I'm hoping that this piece of work gets it kind of back on as well. So where did we get to? So we developed a raw tool. Still kind of need a lot of work to it. We shared that with Alistair and Michael from Social Finance. We looked at interventions, how we could implement these, but we didn't really get to progress them well. But what it has given us, it's given us a bit of a baseline to start to kind of compare where we are across our comparator LAs. So we looked at, what our budget is for placement spend across different areas and whether we're comparable to that, our internal versus external, and some of our costs. So in terms of how it links into the data to insight work, so it's really hard to do this because I'm not showing you the tool, but this is just a bit of an overview. So we see this piece of work that Alistair and Michael from Social Finance is doing as really key, really. So for me, it's that it should start to shape our commissioning intentions. I think we can start to look at where we spend, what the outcomes are for internal and external. And I think, as I said before, the interventions and influence over social care model is quite key. So I think, from a commissioning background, it's, you can put the best commissioning models out there that you wish for, really. But if you haven't got the matching operational model or the matching operational kind of protocols, etc., it doesn't work. It has to be part of a more strategic approach. I think what Alistair was saying before around, the model, the work that they're doing around it influencing and making decisions, I think that's quite key for me. We think this can help us as well around our sufficiency strategy. So we've got our sufficiency strategy, which is currently being updated. But I see this as being quite key to developing consistent sufficiency strategies across the country, really. And as I said before, talking to providers around different models, and how that can work in different areas and looking towards outcomes-based commissioning if possible. I think as a last point, I think it should help us to pull away from some of our scattergun approaches to purchasing. When I say purchasing, kind of purposefully, really, because it's purchasing rather than commissioning. So I'm hoping that the work that we're doing here should start to help us have a different conversation, a different commissioning model. I think, bear in mind, I come from a predominantly an adults background, and the commissioning is very different in adults and children's. So I think I'd say that the adults one is a bit more kind of, I guess, a bit more kind of developed, and I think, but there's massive opportunities in children's to do something differently. So that's my bit, Alistair. I know it's not kind of mad data in there, but I think it gives hopefully people a bit of an overview of what we try to do, and it did, you know, it hasn't progressed as much as we wanted it to. But I'm hoping that the work we're doing with Data to Insight will really kind of push it forward.
I think that's really useful. Thanks, Indy. Shall we pass across to Alistair now? Alistair Lee. We have two Alistairs involved in Data to Insight, and Alistair Lee is the first of those two. He's going to talk to us about East Sussex's work on SEND.
Can you see that, Alistair? Have you got it?
I can indeed, yes.
Great stuff. Good afternoon, everybody. So I'm Alistair Lee. I'm Children's Services Data and Information Manager for East Sussex County Council, and actually work quite closely, very closely with Alistair on the Data to Insight project. But this is something that predated Data to Insight by some years. Move my slides. There we go. So the problem we identified was in 2014, where the number of EHC plans in East Sussex was increasing significantly, and that was partly due to the extension to 25, up to 25, but not entirely. There was other things going on that we wanted to know. And it was a real sense of, you know, this is kind of getting out of control. We don't understand it. We need to get a grip of it and look at the long-term impact of what's going on. So myself and my team, with our data hats on, thought, you know, could we take historical SEN data and demographic projections and produce something of use to the service and managers? And we produced the first set of data in 2015. And we've been running ever since, and it's proving quite successful. And I'll just talk you through how we've done it. So the data is fairly straightforward and something that you probably have already if you work in children's services. So it's the school census number of children with statements, EHC plans, broken down by a banding of severity that we have locally. So A to E, which is a local banding of the severity. Age, and age allows us to do both age but also school stage, and a categorization of the 11 primary need types. So interesting, we're not using SEN2, we're using school census here, but that's the data we use. Then we have the population projections to forecast the future population, and that's the starting set of data. And the basic assumption is that things will stay the same. That actually, the default assumption is that current prevalence rates for different primary need types will remain unaltered. So as you have X% of the population has got ADHD, and as the population increases, that number increases, and that kind of is the basis of the initial assumption. But that's not true. Over the periods with data we've got, we can see that some are increasing more than others, and some are dropping off more than others. And so that is factored into the model as well. So we have a 5-year trend of what the trend is, either upwards or downwards, or fairly flat. And so all those three things are factored in. So we've got the school census data, we've got the population projections, and then we've got the 5-year trend factors. It's all pulled in. That's then stuck on some charts. So we do the maths and we make some pretty charts. And this is the most recent overall version for the different primary need groups. The yellow stuff is historical. So that's, you can see back to 2014-15 where we started. That's all now actual data. But then forward, you've got the real data. And as you can see, ASD is going up. And then equally, you've got SEMH is going up. So that was a bit of a surprise to everybody in terms of how big those changes were. What we then built into the model, and it's not just a mathematical model, is that we needed service refinement. We needed a challenge from the service to say that, you know, some of those lines are stupid. Don't be ridiculous. Go back and think again. And so we ran initially a workshop. It was a day-long workshop and went through every indicator at every age group and got them to say, yes, that looks right. It's a bit steep. It's a bit low. And we refined the measures. So you can see in the middle of this, the picture in the bottom, you've got the agreed trend factor. So that is the one agreed with the workers. It's not one that we've calculated. You can see above that the average yearly change is 2.7, but they've actually agreed a slightly higher one to do that. And then beneath that, you see the various charts. And what we do in the meeting is we've got, that's dynamic. So Joe, my colleague, can actually change the numbers and get them to look at what the trend does. with that, then had a really good discussion with the staff about what this means for them, and does it feel right to them as professionals. Once that's all agreed, that then forms the basis of the forecasts. Each year we do an annual accuracy check, so we've been doing that ever since 2014, 2015, and generally speaking, we are it's between plus or minus 2.6% out. This year we were under forecast by 0.2%. So that's an actual total was 3,633 compared to 3,624, and that's spread between the age groups and the primary needs. For example, ASD was under forecast by 5.9%. That was 66 pupils. So in 2019-20, there were 1,053. We predicted 1,017, but actually the actual was 1,183. And that under forecast is part of that. You know, the workers and we had set the trend. So that's where we got that data from. It's not a perfect science, and it's the trends over time that are as important as the detailed actual numbers in helping the service planning. So is it going up? How steeply is it going up? And if it is going up that steeply, what does that mean longer term? Also, it enables you to think about what interventions you could put in. So if it's going to go up, is there an intervention we could put in that would bring it down? And you could then see the impact of some of that, hopefully. So how is it being used? Has it had an effect? Do we continue to use it? So we keep producing it. We have run the workshops every year. The workshops have got shorter as people got used to it. But the real impact of this is that in a couple of years, we're going to open 2 new special free schools to deal with ASD in East Sussex, one in Eastbourne and one in Hastings. And the forecasting data is, as my colleague, the place planning manager, we continue to use the forecast to determine the next stage of our strategy to create more SEND provision in East Sussex. So quite a simple mathematical tool, but it's a mixture of that and actually working with frontline staff to understand, to get their sense of what is changing. That's built the model that then enabled us to do this work. So that's a very quick run through. I think that's all from me.
That was a marvellously speedy run through. Thank you, Alistair.
As ever, Alistair.
So a little bit earlier than planned then, can I pass over to Sarah from Surrey, who's going to talk to me about her pathway modelling. Before I do so, sorry, just welcome new people who've arrived in the meeting since we started. We're just running through a few presentations and kind of overviews of examples of data modelling practice in different councils at the moment, and then we'll have a little bit of space for questions and comments at the end. We're recording the session, so if you don't want to be recorded, then now is your opportunity not to speak. But if you're quite happy, then otherwise feel free to pop a message in the chat along the side, or pop your hand up when we get to the question section later. Sarah, are you there to take over from me?
Yeah, I will just share my screen. Has my screen loaded correctly?
Yes, it has. I can see you there. Thank you.
Wonderful, thank you so much. So good afternoon, everyone. I am Sarah Ricciardo from Surrey County Council, and I am here to present about a model that we created about a year ago for our local authority. So about a year ago, it was effectively, well, not the beginning of the pandemic, but a few months in. And Surrey County Council, like the vast majority of local authorities, had a very important need to understand the demand and the capacity for social care services that would be projected into the following few months to try and understand whether there were any criticalities that we needed to address and whether our staffing arrangement for specific tasks to be carried out within our local social care was adequate to the projected need. We needed to do so on the basis of different scenarios. At the time, obviously, we had no real understanding of whether there would be 1, 2, or multiple lockdowns, and we needed to account for the possibility that there might be a few, there might be none, they might come at a different time. So in order for us to cope with the need to basically understand our projected demand and our projected capacity, we built a model that related the demand that we were projecting with the capacity that was projected to be available for different teams. And that was crucial for the council to make very strategic decisions about using resources effectively and shifting people across team when there was an identified need. So the way we went about building the model was effectively using data sets from different teams. I will run you through the structure of what we did very quickly. So basically, Surrey County Council has an offer of social care that goes from level 1 to level 4 as a windscreen of support, basically. And we start with our children's single point of access that is available universally. The level 2 aspect of our offer is basically our early help offer, both internal and external. And level 3 is the more social care in a traditional sense, as it were. So children in need, child protection plans, and children with disabilities. And level 4 is around care proceedings, children who are looked after, and caregivers. So in essence, basically, the general understanding, the general sort of structure of the model was that we knew that effectively the demand that comes through our children's single point of access then trickles down either into early help or social care, and a proportion of our social care contacts that then become assessment mean that a child becomes a child in need or is subject to a child protection plan or becomes basically looked after as a result of care proceeding, and a proportion of those who become looked after either is reunified or ages out of care and becomes a caregiver. So we took the data sources for all the different teams and we looked at how indicators related to one another and built a model that effectively, with a number of delays and trickling down a proportion from each level into the following level, gave us an understanding of how contacts in the children's single point of access related to the number of new child protection plans, for example, or to the number of children who became looked after. As I was mentioning at the beginning of the presentation, we needed to look into the possibility of different scenarios in terms of different lockdowns and if and when this might happen. So we created a long list of 12 scenarios and our leadership selected 3 for further development that were deemed to be the most likely scenarios that we could face. And we then developed the models based on an assumption of the influence that lockdown would have had on our demand based on the change that we had observed in the previous 3 months when the model started to be developed. So basically we took April, May and June data that were from our first lockdown and looked at the difference with previous months and with the same months in the previous year to understand what the likely impact of the lockdown itself had been on the demand for different services. Let me talk you through scenario 1. So if I go on to the first tab and I zoom out, you will see that the colors that you have looked at in the first structure, as it were, are replicated in our overall structure of the different indicators, starting from level 1 access and ending with level 4 support. For each of those indicators, let me pick one. Of basically, apologies, we have a line of actual data. And this is our historical data on which basically we built our baseline projection. And then we created a darker blue line that was our COVID-19 projection, and we then kept updating the data as it came through to look at how closely our projection matched the reality of contacts to social care in this particular case. You can see that on top of the historical trend line plus the projection, there are another green, amber and red line that are effectively the capacity for the team to deal with contacts. I have included in this model the possibility for people to modify these lines by modifying the indicators they are based on. So the lines that you're observing now are an example, and they are based on a maximum 15 contacts per day, dealt with by people occupying 4 full-time equivalent positions. Assuming that I wanted to change this number and say that actually the contacts they can deal with per day are 20, this automatically changes my projection to show me whether the demand is likely to meet the capacity, or there are going to be any issues with facing the demand that appears in the system. You can do obviously the same in terms of the number of full-time equivalents, which allows you to make hypotheses in terms of if there were an extra 2 members of staff, what would that mean in terms of the capacity and the demand, and would that give us what is required in order to face the demand that we are likely projecting as possible and likely in the system. Each indicator, as I was saying, is based on the indicators that precede it, basically in the tree, as it were, with adequate stops and breaks in terms of the time it takes for the different stocks to move into the following step in the system. At the very top, you can see that there is a description of what the scenario looks like and what it is based on in terms of when restrictions will be lifted and if there are any new lockdowns included in this particular scenario here. And also a rating of the likelihood of this particular scenario materializing based on the assessment of our leadership team. What the model basically has allowed us to do is shift capacity between teams. When there was an observation that a certain team maybe had a little bit extra capacity compared to the demand that they were experiencing, they could be moved across team in order for them to support other teams that were struggling at that specific point in time. And it became apparent rather quickly that beyond managing the pandemic itself, the tool would have become useful as a general planning tool for staffing and modeling of demand. So as you can see from now, basically the model was born as an Excel-based spreadsheet, but we are currently in the process of migrating it to a Tableau-based solution so that it will be possible for the model not to have to be updated manually every time, and the assumptions of the model will basically adapt themselves based on the new data that is received automatically as the model will start feeding off of live data sources. So that's our expectation, and we should be able to have the new version of the model that is based on live data probably around the end of summer now.
That's brilliant. Thank you very much, Sarah. And thank you especially because one of the things that I think came out of the piece of work we've just done in Data to Insight around data modeling and demand modeling and figuring out what should we do with our next bit of this project, or how do we take it forward and make it useful to local authorities, is this idea that there's different reasons that you might model, there's different kinds of data modeling you might do, there's different products that might come out of it. And often when you say data modeling to someone, they'll think, oh, he's talking about forecasting, or oh, she means doing scenario modeling, or what have you. You could be doing any one of these things. There's a big value, I think, in mapping system flows and understanding how the system works, so that you can then play that back to your leaders and let them make more informed decisions and have a better sense of when things change within that system. But equally, things like that scenario modeling, increasingly valuable when we're in periods of uncertainty. So yeah, thanks very much for that. That is the end of our showcase of presentations, and we've now got about 15-20 minutes to take questions, have a bit of a conversation, take input from anyone else who's got anything they want to feed in at this point. I'll kick off with a question from the conversation pane there from Joanne Harris, which is a detailed question about the SEND modelling for you, Alistair Lee, asking about if you only use the school census data, And if this is because you don't have a lot of out-of-borough placements, or that the out-of-borough isn't a big factor for you.
And the answer to that, I was typing it as you asked me the question.
All right, okay.
We have relatively few out of boroughs because we're large, so we're East Sussex County Council. We border Kent, Surrey, Brighton and Hove and West Sussex. But at the beginning, my colleagues did a lot of work on what was the best place to get the trends from, because all we're looking for is trends. So they looked at SEND2, they looked at school census, and they did a regional version of it as well. So they took all the data from the Southeast region from the school census and SEND2 to identify the best trends, and ultimately went with the school census just for East Sussex 5-year trend. So it's probably something, if you were going to recreate this, is to look at what you think might be the best source of data for it. Because yeah, as you say, if you've got a lot of going out of borough, you won't know about them in your school census, but you will know about them in the SEND2. Hopefully that answers the question.
There's another fun question for us from Ben there, relevant to our first project. Do schools being closed have an effect on demand at the front door?
Yes, they do, and I can actually show you a relevant chart. Apologies, let me see if I can share my screen again. Is that sharing?
Yep, that's on, yeah.
Wonderful. So you will see that even from our historical data, September and October tend to have a pickup in demand in terms of the contacts that come to the children's single point of access compared to the summer months. This is the line that we would have expected had there been no COVID-19. So basically this would have been the baseline in terms of the demand that we would expected coming from schools. Actually, our projection was much higher, and the actual matched our projection with a big peak coming in September and October, which was actually much bigger than what we experienced the previous year. This was also due to the fact that obviously schools had been closed for quite a while during the period of the lockdown, and had not had an opportunity to refer children where there was a concern. Plus, concerns increased in general. Basically when schools reopened, that meant that there was a lot of pent-up demand that was unloaded onto our children's single point of access, absolutely.
It brings up another point which I had meant to cover in my presentation but didn't, about not being blind when you're modelling to the factors that you're not modelling. And our first front door demand modelling tool for lockdown ignored the fact that there were seasonal variations in referral volumes for local authorities. And so a lot of local authorities will see much higher volumes of referrals to social care in October, November time than they will in the summer or the kind of the late winter, February kind of time. And once we applied a kind of historical model to say, what's your normal seasonal variation, we found that actually the significance of that in some local authorities was much greater than the change we were modelling in volumes because of lockdown. And that was interesting, and kind of raised that point that you can't afford not to be aware of the wider context, whether it's something like that in terms of seasonality, whether it's the kind of big macroeconomic changes that are going on in the wider world, or also whether there's strategic changes happening locally and a decision someone makes to manage demand in a certain way, which I think someone asked a question or made a point about in the conversation as well, which I've now lost.
Yeah, the way we accounted for that phenomenon was effectively definitely looking at seasonality the way it had been observed in previous years, because as you say, there is a strong seasonal component in terms of the opening or closing of schools at the best of times. But also we looked at basically what we termed at the time as missing contacts. So effectively we looked at what our normal seasonality would have been in the lockdown months. And then we projected the demand that we would have normally, like we projected the actual demand that we had received, and we realized that we had far fewer contacts than we normally would have expected. So that was obviously partially due to the closure of schools, and the way we took account of that in the modelling was effectively using those contacts as contacts that needed to be basically made up for, in a sense, later in the year, and therefore they went to add to the projection that we would have otherwise created for COVID-19.
Mm-hmm. I'm just working through the chat channel looking for questions we've missed. But feel free to chip in by chat or by voice, anyone who'd like to do so. As we
Alistair, there's
yes,
a question in the chat from Neil Kangscarf.
What calculations are you using for forecasting population, and how do you factor in population migration, etc.?
And the short answer is pop group, and I was typing that into the chat again. So yes, we just take the data that's provided by ONS, whoever, it's LGA manages pop group now. We have a team in East Sussex that looks at the population figures as well. So our colleagues in corporate deal with that, and we get the data from them. So in a way, it can seem like quite a blunt tool, you know, because it's basic maths, that goes up, that goes up. But it's the element of then presenting that for the challenge with the workers that is the most valuable part, because it gets it closer to reality, but also it gets them engaged in understanding. And the workshop, one of the first workshops I was in, was really great, where the different parts of the team started challenging each other about, you know, do we think MLD is going up or is it SEMH? And actually, because there's a relationship between the two. So really interesting, and the head of service, Nathan Kane, has been very keen that they continue every year. So we've gone from a day-long thing to now it's a half-day thing. And actually the most recent one was done by teams because people are used to the process, but very valuable in terms of not only setting the forecast, but getting to understand between the teams what the challenges are for the service. So it's more than just a forecasting tool.
One of the interesting things that came out of the data to insight demand modelling workshops has been about just how many different things there are that you could fold into your model, and there are so many factors there. And at a certain point, you have to you do all this open-minded stuff about throwing everything on the paper and figuring out there's all these different things. At a certain point, you have to close your mind and figure out these are the things that we're going to start by modeling, and then see where that takes us and if it works. And kind of this idea of not letting the limitation of what you're doing stop you using it if it turns out it's useful and it does something that works. It takes us around to sorry, Alice, do you want to chip in there?
I was going to leap in, and my experience from the SEND forecasting model, which predates Data to Insight, said was very much, it was a leap of faith for the managers to say, you know, we can do this, you know. So it's basically, shut up, Alice, to go and do it. You know, you keep bashing on about the fact that in principle you can do this, so go and do it and show us what you produce. So there is a relationship thing between myself and the service managers about them being okay with me producing the stuff for them. As you know, in our work, you can produce the chart as much as you like, but if nobody reads it or nobody's got any interest in it, it's pointless. So it's how you then work through that. And I think it might have taken it did take quite a while for me to get the service managers okay for me to do something in principle as a test, which they then saw the value of. And so it is that's part of the process. As you know, you can't just build a dashboard and everybody loves it. You have to do a bit of work around the edges to get the uptake. And one thing I haven't said, and it would be unfair to miss it out, is that the service managers in the second year commissioned Mastodon C to do SEND forecasting using their model. And they've continued to run both our model and the Mastodon C alongside each other for about 3 or 4 years. And eventually concluded that they produce very similar information and have kept ours, and Mastodon C have obviously developed theirs, but we're not using them anymore. But it was really useful to have those two running on side by side. So the fact that, you know, even in this conversation, we've got almost 3 versions of looking at demand in children's services for children looked after is great. You know, we have to have the different models and test them out and learn from each other and stuff like that. So yeah, really good to have the different bits.
It reminds me of a great conversation I had this year with someone I won't name about how they could do quite wonderful and remarkable things with maths to do their forecasting, but actually the thing they ended up taking to their kind of key stakeholder, the person who paid the bills, was usually a historical line with a trend extended, because that was the only thing they could get the person who paid the bills to kind of take seriously and worry about. And it makes the question I wanted to ask, really, which Alistair, you touched on in your presentation, but I'd be interested to hear from Indy or Sarah, if they've got different perspectives or similar ones, about that conversation with leaders and what matters when you're having that conversation. What are the, are the tricky bits? Are the key factors that go into the, the recipe of making something that you can present to a kind of a director level decision maker and say, this is what we're going to do because my modeling says this is the case. How does that conversation work or not work, as may be the case?
In my experience, the reason why that conversation worked and it was natural, it was because people were involved in the creation of the model from the very beginning. So as they had helped drive the assumptions and the work that was required for us to produce the model, they were then more likely to give us the buy-in that sort of validated the findings and said, yeah, okay, so we are going to be driven by what we have participated in creating. And that means that what the model is telling us is that we need to do X, Y, and Z. And that's exactly what we are going to do.
I agree, Alistair. I think if you've got that buy-in at the start and it's part of the work forms part of a council or a children's or adults led program, that it's attached to something. So it's kind of like, it's key, it's there, it's visible, there's a deliverable, you come out with a deliverable and actually everyone gets it, because actually that's what they're expecting, I guess. I think if you just land it cold and say, like, here's my model, now go and do this, I think will be met with quite a lot of resistance to it.
Yeah, that makes sense.
Yeah, I agree with both of those. And what you said, Alistair, earlier was, here's a model which explains why we're going to make these decisions. It's more about, here's a model that's going to help you make your decisions. It's only part of what they're going to do. There's going to be a lot of discussion in your senior management teams and with your heads of service about the various possibilities. But if you've got a tool that can help them visualize it and maybe tweak some parameters, very basic, then it's a tool that helps. It's not a tool that gives answers.
There's a bit right up at the top of the chat. I missed a question from Joanne about, has anyone done any modelling about how needs change over time? This is where I'd like to go with modelling, but currently it's just a dream. Actually, there's a team in GMCA that I've spoken to who are doing they've done a prototype system pressures thing, and it looks very much like a visualization of conversations I've had with other councils about managing the whole flow of cases through their system, and seeing that when sometimes they might see their child protection population has gone way out of control, and then it started to come down, but as it came down, the LAC population started to rise again. And they're kind of building this map for their local authorities in Greater Manchester that shows you the kind of different levels of service, like contact, referrals, assessments, CP, LAC, what have you, and showing you over time how high the volumes are in each of those systems alongside each other, just to show that kind of level of pressure. And I think that's quite interesting in that area. The other thing that Sarah's work, I think really what excites me about Sarah's work is that potential to say, well, we can kind of see this movement through the system, through this flow. Can we use that to say, well, last time we had this many referrals, it ended up in that many LAC later, or something like that. But I think that's not something that I've seen working elsewhere. Joanne, you wanted to chip in?
I was more thinking about SEN needs. So obviously you get to a point, well, there's a point along the system where I guess there will be a proportion of children who are SLCN until they're a certain age, and then they get a diagnosis and they move into the ASD category. And it's about understanding what proportion of children that happens for, and also at roughly what age it might happen, just so you can look at what demand there will be at different ages. That's more where I was going.
Okay. Can we pass across to Alistair, who's got his hand up, and then come back to Indy afterwards, who'll be talking about something we were talking about before, possibly?
Yes, just on that one, it is very interesting, and you can see it in the historical data, and equally you can see fashions as well. So as something becomes the thing that people are being diagnosed with, you can see those going up and other things going down. There is also, yes, as you say, at key points. So between the key stages, you'll see changes in a diagnosis or a primary need, and you'll pick it up in your data as you do it. That again forms part of the discussion. On the slide, I've got we have a whopping great slide pack for our presentations, and in that there is a box that gives the justification for the trend, and that's where the frontline staff say, well, we know that, you know, at year 7 a lot of X happens, and you know, but going from nursery to primary, a lot of Y happens, and that's why that affects the trend. So that a lot of that is coming in through practice. And also the reason I put my hand up is that earlier on, Ben Watkins asked about how much of the shift of demand is due to change in threshold rather than lockdown. And I would say yes. Some of it is to do with threshold, and that's just understanding the system, I would think, really. Hopefully that helps on both questions.
Yeah, thanks, Alistair. Indy, you stuck your hand up and I just ignored it. I'm very sorry.
No, it's all right.
That's what you were going to say.
That's cool. It's just quickly on. I've got 2 quick points. Just quickly on Alistair's bit around the growing needs. So we did some work in Dudley on SEND. So we found ASD, SEMH, and speech and language as the kind of the primary growth areas in Dudley as well. So it's consistent with what we're finding as well, as if that's any help. And then just quickly, I think Ben asked a question quite a while ago. Hang on a second. It was, what specification can you give of opportunities there are in children's commissioning to adults? Ben, was that linked to what I said, Ben, or was that something else? I've got an answer to it if it is.
So should we pretend that it was
Okay.
in the absence of a reply?
Okay, assuming it was then. So so I'll give you a quick example of something in adults where, you know, it's the principles of commissioning really. So you've got, well, we've done in Dudley, we've done like provide-led models for older people. So it's like a model that it incentivizes reduced care. So older people going into hospital, coming out of hospital, reablement, hospital discharge. You know, the whole model's like predicated on like pay an enhanced rate at the start with them, with the providers. So you select a few providers, pay the enhanced rate, skill them to deliver the reablement service, wrap around the support around that person, so OTs, physios, technology, etc., with the aim of reducing that person's ongoing care need. So it's like pump priming at the start with the provider that gets it and understands it and wants to do it. So that's, you know, I know it's older people, I know it's a totally different demographic, but actually the principle of the commissioning model shouldn't be any different. You know, you're talking to providers who should be in kind of like, you know, in the industry to make a difference really. And if you can kind of tap into that bit of their work, get the right ethos providers, but also tap into their financial benefits of it as well, because everyone has to win in this. That's the bit I think around, you know, there's different ways in adults that commissioning works, and you can flip it to children's if there's a desire to really.
Thanks, Indy.
Cool.
Can anyone help me out finding any questions I may have missed? Or do we think we're done? Logan asked, what is the underlying model being used for the forecast? Logan, do you want to chip? You got your hand up. Do you want to chip in?
Yeah, sure. I wanted to get a bit more clarity on what the underlying model was for the contacts data. Like, I understand it's weighted, but what the underlying model, if you're using a regression model or exponential smoothing or Serema, I just wanted to know what the underlying engine was.
Was that from Sarah's work or from the Data to Insight?
I believe so, Sarah, yes.
Sarah.
Right. So in terms of basically what we have created, basically the engine running at the bottom is a very simple baseline, as it were, that would have followed the trend for different indicators according to the data in our possession from the last 3 years. So that was basically the baseline. And then based on the baseline data, we modified the baseline data based on the behavior of the different indicators in lockdown months. And we then created basically a return to baseline model that took the indicator from baseline to lockdown period according to the behavior that we had experienced in the first lockdown, and then from the lockdown period back into the baseline over a period of time when we basically saw the effect of the lockdown waning. And obviously the process was repeated for the different indicators according to their different behaviors during lockdown, but also according to the impact of the indicators that they were based on. Does that make sense?
Mostly. So it's more like a weighted regression. So you said it was a simple vision model. Okay. Okay.
Yeah.
Okay. Thank you very much.
Thanks. I think that is probably a good point for us to sign off before people need to leave anyway at 3 o'clock. So I think all that remains is to say thank you very much for coming. Thanks for useful questions and interesting answers from people. Hopefully some of that was useful. If you would like to catch up with anyone after the session by email or what have you, then you'll have some contact details somewhere. Find a way to get in touch and we will find a way to put you in touch with the person you want to speak to. I'm usually quite an easy person to find, so by all means come via me if you'd like to. The Data to Insight project, we're running development openly in our Slack channel for local authority analysts. So if you'd like to keep tabs on that as it develops, then by all means ask me for an invitation to that channel and I will pass it on. Yeah, sure, we can find a way to circulate the slides as well. That'll be fine. Thanks very much for coming. Thank you, Alistair, Indy, Sarah for presenting. It's been really useful for me as well as for participants, hopefully.
Thank you.
And thank you, Sam, for hosting us.
Thanks all.